I'm Jules with Young Women's Resource Center. I'm a childbirth educator, doula, and lactation specialist here at the center. Today we're going to talk a little bit about pregnancy anatomy. We're not going to go really in depth, but we're going to touch on all the topics so you have a better idea what's going on while you're pregnant. So we're going to start with breast/chest tissue. So start right here. So during pregnancy, changes of your breast happen, or your chest. They become denser, fuller. You'll notice that your areolas will become darker, and this is all preparing you to be able to breastfeed or chest feed after your baby's born. Each pregnancy, you develop more milk-making tissue, so it's pretty cool. Each time you have a baby, you'll be able to make more milk. Size doesn't matter, so no matter if your breasts are large or small, you'll still be able to breastfeed. If you have any questions about breastfeeding and want to know more about it, you can reach out to the center. We have a few lactation specialists on hand, and we will be able to help you out. So next, we're going to talk about the uterus. The uterus is where your baby grows inside your body. It grows from about 5 to 6 times larger during pregnancy. So your uterus is pretty small, and then it grows and grows to hold your baby. Next is the placenta. The placenta is an organ that develops in pregnancy, just during pregnancy. It attaches to your uterus, like we talked about right before this. It's responsible for providing nutrients, oxygen to your baby through the umbilical cord. It also removes waste from your baby's blood. I'll show you guys. The placenta is kind of cool. So this is your placenta, this red thing. It's a little organ that your body creates. It holds the baby inside. We're gonna get to the other parts, but I just like to show that. The outside is like the side that attaches to the uterus, and it kind of looks like meat, kind of raw. And then the inside where the baby sees, it's pretty cool. They call it the tree of life. And so after you have your baby, if you want to look at your placenta up close, you'll see all the veins and arteries, and it looks pretty cool. It provided all that nutrients to your baby throughout your pregnancy. Umbilical cord is next. We have our umbilical cord in here. It attaches to the placenta, and it's made up of 2 arteries and 1 vein. The artery carries the blood from the baby to the placenta, and the vein carries blood to the baby. We're kind of like working our way through this. So we have our placenta, and on the inside, it's attached to your umbilical cord. And then your baby is attached to that. So we can kind of see how we're working up this. Baby goes inside of here, and that brings us to our next thing. Our amniotic sac is going to be next, which we're going to talk about. Our amniotic sac is right here. So we have our placenta, we have our umbilical cord, which is attached to the placenta and to the baby, and now surrounding that is our amniotic sac. So the amniotic sac is to provide protection of your baby during pregnancy. Also inside the amniotic sac, we have our amniotic fluid. So they kind of go together. The amniotic sac and the amniotic fluid together, they provide protection, they help regulate the heat of the baby during pregnancy. What's pretty cool about the amniotic fluid is while you're pregnant, your baby starts practicing breathing. So they're swallowing amniotic fluid and peeing it out consistently so they can practice those skills they'll need once they're born. Next, we have our cervix. Our cervix right here, it acts as a doorway between the vagina and the uterus. So it's kind of like this nice little green line here, it kind of separates them. During early pregnancy, it's closed, and it helps prevent any bacteria or anything entering into the uterus that could harm your baby. Inside this cervix, during pregnancy, it builds up a mucus plug. And this kind of continues to help stop that bacteria from getting into your baby. So towards the end of pregnancy, your cervix starts to soften. It's called effacing, and it starts to dilate to open up to let your baby out. And also towards labor, you'll lose your mucus plug in pregnancy. Sometimes it doesn't happen until you're in labor, sometimes it happens before. Our cervix, it dilates, and what I mean by that is it opens up as you're getting close to having your baby or during labor. You start at 1 centimeter, so it's really tiny, like this Cheerio right here.